Hello, Michael from Happy Chiropractic. Thanks for watching. What I want to discuss today with you is results of a research study. I've got my iPad here because whilst I am a geek, I can't remember everything. And this research is titled Spinal High Velocity, Low Amplitude Manipulation. So that is chiropractic adjustments. That's a description of it, technical. In acute non-specific low back pain, so people that have a lot of or severe lower back pain, and it's a double-blinded randomized controlled trial comparing the hands-on approach with diclofenac, also known as Voltaren, or an anti-inflammatory. And this was published in the Spine journal, and the Spine journal is it's important to mention, it's not a journal that is written by chiropractors. It's not a journal that has any bias towards chiropractic. Just wanted to put that out there. So the results of this study were that they had 37 subjects that received spinal manipulation, 38 that received diclofenac, and 25 who had no active treatment. And comparing the active arms, so not the no active treatment, but the diclofenac and the adjustments, comparing those two arms of the study, the conclusion showed that people with acute non-specific lower back pain, the spinal manipulation group was significantly better than the non-steroidal anti-inflammatory drug and clinically superior to placebo. So effectively what I'm trying to say is that for the acute non-specific lower back pain, non-specific means it's not a diagnosed arthritis, it's not a diagnosed tumor, it's not a diagnosed infection, it's lower back pain, not quite sure why you've got it, but it's pretty severe and acute. The hands-on approach was in this study was far more effective than taking the diclofenac or the anti-inflammatory. So heaven forbid you're in the circumstance that you have some lower back issues, albeit they're very common in society, unfortunately. My suggestion based on this research from the Spine Journal is get yourself into the hands of an experienced practitioner who can provide that high velocity, low force adjusting or manipulation to the spine before you resort to taking anti-inflammatory drugs or, heaven forbid, even more so, opioid pain-killing medication. Hope you found this informative, and wherever you are in your health journey, I wish you all the very best. Cheers.